So we're going to do the next summit on Uttar Pradesh after this, actually. So
okay,
there's a big state, and then at the end of this summit series, we're going to do like a coffee table book on all this conversation, key points, and we're going to share that with different stakeholders. Like these are the suggestions from India's best thought leaders on public health, health systems, technology. So I think that's also the plan, maybe. And the last one is in November in Calcutta. So after that, we're planning early next year, we will publish a booklet on the whole summit series, essentially about how to reimagine the future of health in India.
excellent, I think.
All right, I am rolling the video. All the best. Thank you.
All the best.
It's been more than a year since the COVID-19 outbreak. The pandemic has created an unprecedented global health crisis. It's time to look back on how our healthcare and life sciences coped with the uncertain times. It's also time to look at the future. It is time to recalibrate. It's time to act. Health of India is a series of high-profile power-packed virtual summits bringing together more than 50 speakers from across India. Throughout these summits, health ministers, policymakers, top CEOs, thought leaders, and technologists will initiate a new dialogue with focus on innovation, technology, and policymaking. Join the conversation as we respond to, recover from, and reimagine the future beyond the current global health crisis. Health of India. Time to reimagine the future. It's been more than a year since the COVID-19 outbreak. The pandemic has created an unprecedented global health crisis. It's time to look back on how our healthcare and life sciences coped with the uncertain times. It's also time to look at the future. It is time to recalibrate. It's time to act. Health of India is a series of high-profile power-packed virtual summits bringing together more than 50 speakers from across India. Throughout these summits, health ministers, policymakers, top CEOs, thought leaders, and technologists will initiate a new dialogue with focus on innovation, technology, and policymaking. Join the conversation as we respond to, recover from, and reimagine the future beyond the current global health crisis. Health of India. Time to reimagine the future.
All right, good morning, everyone, and thank you so much for joining in. I think time to reimagine the future and time to act on it is right now. Thank you so much to all our participants in here and all our esteemed speakers for joining us on this important and a very, very important discussion, which is called the Health of India series. We've completed 3 series in 3 different states already. We've completed Maharashtra, we've completed Delhi, and we've completed Karnataka. And this brings us to Andhra Pradesh and Telangana today. So once again, on behalf of the entire team of Data Leads, Health Analytics Asia, and our partners, SAP and Entity Data Business Solutions, I welcome all of you present here. I know it's just not easy to do online sessions, to attend these sessions, but I think this is the only way that we have right now. We will wait for things to improve and then go back to in person. So thank you so much. I mean, yeah, like I said, you know, like all other webinars and conferences and summits that have been happening, this is also going to be virtual. After every summit, after every e-summit that we do, you know, we wish the next one is going to be in person, and next one is going to where we are going to raise a cup of coffee together and, you know, see each other in person. But sadly, it isn't happening. Maybe for the Uttar Pradesh one, you know, if we can try, but I don't see things happening there too. So yes, thanks again for joining in. Last couple of years, all of us have been witnessing the worst crisis of the century, actually, a crisis that has taken away and claimed lives of our near and dear ones, and and livelihood as well. We've every day for last almost 1.5 years, we've like got up to a phone call or a news or a heartbreaking or devastating news of somebody near and dear one, or a friend or somebody that we know of has passed away because of the pandemic. It has been a very, very difficult time. It's almost now 2 years. I think we're in the end of September now, and it's almost 2 years into the pandemic. And I think it's now time to take stock of how healthcare and life sciences have managed to cope up with such stress, and also discuss strategies that have been developed to address the gaps and even the smallest of vulnerabilities that were witnessed during the COVID-19 pandemic. The pandemic actually created an unprecedented situation and a very, very uncertain time in global health. But at the same time, it has also created new opportunities for future partnerships and robust solutions in healthcare. So I think, as our tagline goes, it's time to reimagine the future, and the time to act is right now. With that, if you allow me a moment, we will start the summit today. All right, so a brief line of introduction. My name is Surabhi Pandit Nangia. I'm the Director, Outreach and Partnerships with Data Leads. On behalf of the entire team present in here, Data Leads, Health Analytics Asia, SAP, and Entity Data Solutions, I extend a warm welcome to all of you present in here and attending these series today. So what's the objective, and why are we all here, and what brings us to do these series? This Health of India series actually, is a dialogue, is a pan-Asia initiative to build a committed platform from strategic collaborations in the ever-evolving areas of health and life sciences, and so much needed in the days today. These series will feature health ministers, policymakers, CEOs, thought leaders, technologists, and journalists as participants in high-level deliberations on health, with a focus on new innovations, technology, policy making, spread over the series. The entire series has been planned that it's going to be spread over 8 states. The series will highlight pivotal perspectives of the states that drive India forward, promising to shape the country's healthcare and life sciences ecosystem in the years to come, and to ensure that we do not repeat and do not face the crisis that we've been facing in the last couple of years so much. I would take a moment to introduce what our company Data Leads does. Data Leads is a company which is based in Delhi. Primarily, Data Leads is a digital media and an information company which aims to help people understand and, most importantly, engage in the world around them. We work with world's leading media and tech companies and regularly partner with them in different collaborative initiatives that we've been doing the last few years. Our work spectrum actually includes capacity building initiatives, fact-checking initiatives, research, data-driven content, and events with a special focus on building collaborations in public health. We are also really, really proud partners of Google News Initiative and Internews in launching pioneering information literacy and fact-checking initiative in India. We started the Google News Initiative in 2018, wherein we chose 250 truth warriors, journalists and media educators, and we trained them over TOTs. And these truth warriors ever since have been fighting big time on medical misinformation and fake news. In fact, another initiative which is called the Fact Shala, which is a media literacy initiative for tier 2 and tier 3 cities, has been doing really, really great. And we are really proud of all our work and all our partners. One of our flagship projects, which is called Health Analytics Asia, is Asia's first data and health information platform, building collaboration between journalists, doctors, technologists. Our approach to build collaboration with doctors is globally recognized as a unique initiative in healthcare reporting, and it has won the membership puzzle project, which is by the New York University. And in fact, we've also been the proud recipients of the British Journal Medical Award. And about the agenda and how would the flow of things be today. We understand there is an extreme fatigue that people are witnessing, and all of us daily, we start with like checking our calendars as to what's on Zoom today, but this is how we are. But we're going to keep this session, trying to keep it as crisp and short and focused as possible. We start with the first panel discussion on reimagining the future of health, and then move on to the flash talk sessions on innovation and collaboration. After the first session, we will start taking the question and answers. We will devote 10 minutes. And so I would request all our participants to post their questions, whatever that they may have, in the chat box therein, and we will start taking them after the first round and even the second round. So this is how our agenda is going to be, and we will ensure that we wrap it on time. Now, so setting up the stage for our plenary session on reimagining the future of health. Our goal here is to bring to you different set of perspectives from different experts who will share their ideas and their visions about the challenges and new opportunities ahead in healthcare. The idea, the focus, the basic idea behind the entire series is to drive collaboration and partnership to come together to make a dent in this huge challenge that we are all facing today. So we have 5 eminent speakers, in fact 4 now. We were actually supposed to be joined by K. Sujata Rao, but she's unable to join in. So before we start, before we start the panel discussion, I would want to take a moment in introducing all our eminent panelists present in here today. Thank you so much once again for joining in for this series. Dr. Radha Rangarajan. Dr. Radha Rangarajan, our panelist, our speaker for today, has a wide breadth of experience in managing R&D, spanning the drug discovery and diagnostic sectors. Having run her own startup, she has a keen understanding of optimized product development, pathways, risk management, and delivering to budgets and timelines. Dr. Rangarajan is currently the CSO at HealthCubed, a medical devices company where she leads product development, regulatory, and clinical validation for point-of-care diagnostic devices. Thank you so much, Dr. Radha, and congratulations on the excellent work that you've been doing. Thanks for joining and taking out time and for the series. Our next panelist, such a pleasure to have you here with us. Our next panelist and speaker today, Dr. P.V. Ramesh. Dr. P.V. Ramesh is a strategy and policy specialist. Graduated as a physician from CMC Vellore, he joined the IAS, the Indian Administrative Services, in 1985. He was the Principal Health Secretary and Principal Finance Secretary of Andhra Pradesh, as well as the additional Chief Secretary to the Chief Minister of Andhra Pradesh. Dr. Ramesh has also held senior assignments and positions with the United Nations, International Fund for Agriculture Development, and also the World Bank. Thank you so much, Dr. Ramesh, for being present here today and sharing your thoughts on reimagining the future of healthcare. We are also joined in here today by Mr. Sanjeev Pandey. Sanjeev is a board member and managing director and CEO of Entity Data Business Solutions in India. Sanjeev has over 26 years of diverse and rich experience, including 6 years of management experience in the manufacturing industry and almost 20 years of experience spanning in the IT services industry. With his strategic leadership, as well as deep business and industry skills, Sanjeev is a proven technology and a digital solutions coach. Thank you so much and welcome here for the series again, Sanjeev. Our next eminent speaker, Dr. Jivi Rao. Dr. Rao is the director, AIG Hospitals and Asian Institute of Gastroenterology. He is also the chief of surgical gastroenterology and minimally invasive surgery at the AIG hospitals based in Hyderabad. With an experience of over 3 decades, Dr. Rao has pioneered several innovative surgical techniques and is one of the co-inventors of the NOTES procedure, also known as no scar surgery. That's commendable work, Dr. Rao, that you've been doing. Congratulations on all that you've been doing, and thank you so much for joining in. We were also supposed to be, Dr. K. Sujata Rao, the former Union Health Secretary, Government of India, was also supposed to join us today, like I said, but unfortunately there's been an emergency back home which she needs to attend. So she will not be joining us today, and we will really, really miss her for this discussion that we're going in today. Thank you. With that, I think I will hand over the stage to Syed Nazakat, who will take it on from here. Thanks again, everyone.
Hi, Surabhi. Thank you so much for the introduction and setting the stage for this important panel discussion. I think it's my pleasure to have such esteemed speakers on this very important and timely topic. And as you rightly said, I think we are dealing with something unprecedented. Unprecedented in a sense of scale and unprecedented in terms of the situation, the way it's challenging everything we are doing. And we have not seen in the last 100 years a situation like this, in which the whole world is stuck actually. And 2 years down the line, we still do not know how future will look like, how normal life will look like, and how we will emerge out of this situation. But we are strong believers of that. No matter how many challenges are there, that's a human resilience. There will be a solution to every problem. And that's why it's so fundamental that we invest in new ideas. We invest in partnerships, collaboration. What all we need, perhaps in very difficult situation, is a power of imagination and power of reimagination. How do we really see ourselves in a global setting as innovators, as policymakers, as a country with a 1 billion plus population, strong population, which could create solutions for the world? And that we've seen with the vaccines that essentially has happened, that we are the very few countries in the world which really led a vaccination at such an unprecedented level with a domestic manufacturer. So I'm very glad actually to have this diverse panel here. And the aim is essentially to cover a couple of key areas of healthcare and public health in India, with the aim of looking at the future with solutions. We know there are a lot of challenges, a lot of problems here, hindrances, but we're trying to look at the future in terms of solutions. So that's why I'm glad actually we have a technologist here, a policymaker here, a data person here, and then Dr. Rao with a completely hospital administration and medical field. I'm trying to figure out if we start like this, we can have an open round question in which I will request all of you to make opening remarks, maybe a brief opening remarks about what are the challenges and opportunities in general in healthcare or health delivery in the next 5 to 10 years, you see from your perspective, from your domain expertise. And if I start with Dr. Ramesh, Dr. Ramesh, you have been within the system, you have led initiatives, you have led partnerships at different levels, at state level in Andhra, at the national level and global level as well. What kind of challenges and what kind of opportunities you see for healthcare and public health for India in the next 5-10 years?
Thank you so much. Good morning to everyone, all the panelists, and thank you for having me. And I want to congratulate data leads, the health analytics, and above all the leadership of Dr. Syed. It's wonderful being with you. Now, imagining future with needs understanding of the past. And let me just step back and take a minute just to look at this. I mean, traditionally, in our society, in the South Asian society, and I don't refer to anything in particular, is health, education were not considered public goods. Education was limited to a small segment, so it was exclusionary, and health was considered an individual predicament, not really something that concerned the larger public at large. So I think we need to understand that has been our legacy. And unless we understand this fundamental legacy, it would be difficult to structure. Now, when we got the independence, the constitution, which is essentially the contract between the citizens and those governing classes, it dealt mostly with the political, financial, and the structural aspects. And the political parties really had never come to grips with health as an issue. So we have had series of commissions, starting with the Boer Committee, and recently with Sujata Rao Committee for Government of Andhra Pradesh, when I was with the Chief Minister of Andhra. Number of committees made number of very, very pregnant, very important observations and decisions. The challenges are so vast. In fact, I've always wondered how would a country like India, with its such a vast diversity, and you have at one end of the spectrum, Kerala, which has, is almost as good as any of the developed countries. And then you have the other extreme, some of those states, which are really, really have a major challenges. And then, of course, Andhra, Telangana figure somewhere in between. How would they deal with an epidemic that would sustain? Now, we were confronted in the last 2 years, not just with an epidemic which would last long, but a global pandemic of unknown nature, unknown dynamics. No doubt individual hospitals have done outstanding work. I know Dr. Jivi Rao's hospital has done a phenomenal work, but how did the overall system respond? Health system, lot of burden on the doctors, health professionals, frontline workers. We all need to be grateful to them for the work that they have done. But ultimately, healthcare is not illness care. It is not a disease care. It is a much larger socio-political issue. And it is at the center of the political economy of any nation. And so I do not believe the political leadership has come to grips with this, neither the bureaucracy. So this is the challenge that we face. We face, of course, if we list out, there are any number of things. We are making a transition from a communicable diseases intensive system to a non-communicable disease burden. So you have a double jeopardy of the underdevelopment and the new lifestyle diseases. And then we have this growing private sector, unregulated, the protocol treatments are not standardized. So, and then there is a challenge of human resources, and particularly nurses and paraprofessionals. And lastly, and most importantly, is the evidence, the data that is the backbone of any decision making, any policy making, is so woefully inadequate. So these are the challenges. And going forwards, I would like to believe this is the inflection point for the nation, for the states, first to acknowledge that this is an opportunity. This opportunity has to be harnessed. And if you miss this opportunity, perhaps another opportunity would not come again. I think it's a lot more important for the citizens, for the civil society organizations, and for institutions like that you lead to really say that this is the moment of truth. And we now need to really re-engineer what exists. So I believe that we need to build the health system from bottom up. Now, what we have noticed is the urban areas do not have a health system at all. It has a hospital care. It has good hospital care. It doesn't have a health delivery system. I mean, that reaches out.
Dr. Ramesh, let me take that to Dr. Rao, the health systems, right? I think Dr. Rao, you have been at a forefront during the COVID situation. I've been seeing your work in Hyderabad, like how you lead at a hospital in terms of being available and making your doctors available in the middle of this unprecedented crisis. Like, what is your learning from this situation when you look at future, next 5, 10? Do you think things will change, or we'll be back to normal when health will again take a page 3, page 4 briefs, like a spot some? Or do you think that there will be a new focus on how to improve public health in India or healthcare in India?
Thank you so much once again for having me here. Actually, COVID has really opened up our entire perspective to health to a different level. Health has never been a big concern, especially in our countries, as compared to some of the Western countries, because as Ramesh has said, because of a lot of socio-political issues, we never had big importance given to the health in general. But COVID has opened up a lot of things actually, and everybody started looking at health as a very important thing in the current day thing. And what pandemic has shown is our potential to adapt at a very rapid pace, which you have never imagined before. All of us, the healthcare industry, literally bounced back within a short time, showing the testament of the resilient nature, how we can get back to normalcy. There are a couple of things that actually most significant learning that I personally feel that COVID has taught us is actually we renewed our focus on infection control. Huge country, infections, communicable, non-communicable. See, the way we took from, looked at the hygiene, the masks, the PPE kits, hand sanitation, it not only controlled COVID, but you see the data that is coming up, flu rates have come down, tuberculosis has come down in the last 2 years. This is all because of the preventive measures that COVID has taught us. Second thing, actually, Ramesh has said, resource management. Actually, we have all learned how to resource manage ourselves, be it be manpower, be it be financial things, be it be drugs, be it be oxygen, everything actually. The third thing I think we learned about preventive care, actually, we all of us actually now know that diabetes, hypertension, obesity, these are all things that lead to increased mortality, not only in COVID, for everything. I think people have started becoming aware of that. And the biggest thing that, as Ramesh said, actually, healthcare, virtual healthcare got the best of the thing actually in the last 2 decades. I mean, not only we are able to reach, counsel, treat them, but also that is on the patient side. But at the same time, on the medical fraternity side, actually, the virtual webinars have completely revolutionized, and we are able to connect to people whom have never connected before within a short time and interact with people at such a rapid pace. And I think the entire medical community got really benefited by this, the Zoom calls or the routine calls. I mean, it made tremendous impact, and I think we have been learning a lot from and interacting with people across the globe, and it's made a huge impact on the way that medicine is being practiced today.
Right. That takes me actually to Sanjeev. Like, he's a technology guy, and he runs a tech company which provides solution to the healthcare and health delivery. Sanjeev, if I ask you, like, how do you see future actually, like a larger situation beyond COVID as well, where technology can change really the Indian healthcare delivery? It can change the public health to some level. Do you have a couple of examples? If you want to share them as well, that would be also great.
Absolutely. First of all, thank you, Syed, and very glad to be on this panel. Among all the dignitaries, Mr. Dr. Jivi Rao, I haven't met him in person, but we actually have done some work for the AIG. Very proud to be part of that small, our contribution to the hospital management system. I think what we have learned during this pandemic in the past 2 years, how technology can help quickly address the challenges that we otherwise would have been completely drowned in. How quickly we were able to develop the COVID app, how we were able to collate the data across different hospitals, right from the primary care centers in a small villages, all the way to the highest and biggest hospitals like AIG in Hyderabad. We were able to bring it all together. That's one example. If I take the second example, how we were successfully able to track the vaccination effort that's happening in the country, across the country. None of these systems existed before. This COVID app was not there before. The vaccination portal was not there before. We are able to create, using social media and all the other possible electronic media, we were able to create a kind of a national movement and brought everybody together, doctors, nurses, healthcare, now common citizens, everybody. I think that showed two things. Obviously, our character as a nation, that we can definitely rise up to the occasion. And a lot of thanks and kudos to all the healthcare workers and doctors and police and whatnot. But then all of this information was kind of disseminated properly instructions were given. Now, I come from a small town in Telangana. I come from Adilabad. And most of our people, my family was also affected. Then Asha workers were, they were, as soon as we tested, next day, these people came and delivered the medical kits to us, to our home. How were they able to trace and track where we live? And then every 6th, 7th day, they were coming and checking on us how we were doing. It means there was a system behind it, that they were capturing the data, and that data is being tracked. Now, what I see with this, the opportunity, because this was fantastic to handle the pandemic, because it was more like a disease or infection care. But then all of these systems, if we really make it more permanent and more robust and kind of integrate them all, for example, I throw a concept called health cloud. Let's say all the systems are integrated. Telangana has a portal called the system called EHMS, but then a lot of private and government hospitals do have hospital management systems. If we can bring them all together, integrate them, not completely integrate them, in the way we understand integration, but have a protocol by which certain information is definitely passed on to a specific portal, which is on the cloud, by which we will be able to share the information across with the government, with the policy officials, and also the people who are responsible for preventive care, predictive analysis, and then obviously for the disease and the patient care. So we have an opportunity to, first of all, identify the pandemics in advance before they take the shape that they have taken. If we have the data available to the right people at the right time, that's possible through data sharing, and which is a tremendous opportunity for us. So that's one. It will also give us the patient care. If all the hospitals have the electronic records and if they are made available across, then the tests that we order, for example, today, if somebody goes without medical history, then doctors need to find out what's going on with this guy, and then we order a lot of tests. I think that there is a already loaded system is further loaded, so we can eliminate that additional load and the burden on the system. So that means the patient care will increase, and predictive, the preventive, predictive, and patient care, I think all will get benefited if we adopt technologies across the healthcare sector and then kind of leverage that data and make the data available to the individuals like Dr. Ramesh and Dr. Radha and Jivi Rao, so that they can make the right decisions.
Wonderful. That also takes me to Dr. Radha. You can't solve a problem if you can't diagnose it well. So diagnosis is key actually in healthcare. And Radha, how do you see that, from your perspective, working on solutions in terms of diagnostics, how do you see the future beyond like next 5-10 years? What kind of challenges you see, or maybe perhaps the opportunities which you see for companies like yours in terms of improving and strengthening healthcare delivery and diagnostics?
Thank you, Syed. And a very good morning to everybody who's on this program. And I'm really honored to be with the esteemed speakers on this platform today. I think COVID-19 really threw the world into a tizzy, and it had to, many aspects of healthcare had to innovate very rapidly to adjust to the situation. Although today I want to focus mainly on the technology, I'll say that every aspect of healthcare, whether it is drug discovery and development, taking drugs to the market rapidly, whether it's vaccine development, whether it's production, whether it's manufacture of supplies for the healthcare industry, almost in any one of these segments, there has been a complete change of the paradigm. And the speed of innovation, the speed of delivery to the market has been tremendous, has been really different. And that, I think, is going to be a pattern that repeats in the future, meaning that the world has seen new technologies emerge for vaccines. And those technologies are now going to be applied for other diseases to solve other problems. We're not going to make a U-turn. It's going to keep moving forward. So we have seen this big explosion there. With drug discovery, drugs didn't fare as well as vaccines in COVID-19. We still don't have really good drugs to treat the disease, but people were able to take certain antiviral drugs to market, and they took them rapidly, but we also learned that there were many mistakes along the way, and those could be prevented going forward. there was a whole other area of treatment that opened up by way of antibodies, which will then become, again, features of treatments for other conditions. So we've seen an explosion in R&D and innovation. Absolutely, no doubt about it.
Wonderful.
But let me speak more specifically about technology. So a company like HealthCube, which is focused on building connected devices. These are devices that can measure many parameters using one device, and it's digitally enabled. All of the data gets captured, and it can be seen by a healthcare practitioner at a distance. These kinds of connected devices made a big, they made a big presence in the COVID-19 scenario. And the reason for that is that physical distancing became such a key part of avoiding COVID-19. So I would say there are 5 major things that emerged. One is telehealth, which my other speakers have referred to. It is not just telehealth that boomed in the middle class and upper middle class. Actually, Sanjeev, which is the government's portal for enabling telehealth, telemedicine consultations, it has to date completed 12 million consultations. So telehealth kind of leveled the playing field and enabled access. And access is something that we've struggled with in this country. So we see a new future ahead of us that is based on technology, and it is based on delivery to places where doctors may not be able to go. So that's one major significant change, which I think will continue into the future. The second is that the concept of remotely managing patients from while they're at home. This has been unheard of, but in COVID, that took on a new, that became another major change in the way healthcare is delivered. And this also meant that people were taking more responsibility for their own selves. And they were interested in tracking, monitoring, and working together with the healthcare providers. The third thing is that connected devices like ours, like the HealthCube flagship devices, are devices which are also meant for individual use like AgeWell and so on. These kinds of devices became fully entrenched in people's lives. And what that did is that it allowed people to be measured and tracked on their basic parameters without a doctor or nurse having to be there all the time. And the doctor could make medical decisions based on that. The big advantage of these kinds of devices is that the data is available to anyone, anywhere in real time. And therefore medical decisions can be made not just on the basis of a telehealth call, but also on the basis of real data.
Right.
The fourth big thing was predictive analytics. So the risk of developing severe COVID-19 disease was very quickly figured out on the basis of data that could be analyzed. And these sorts of predictive analytics are going to play into the future as well, because everybody wants to know, how can I avoid situation X? So we built the tools to do this. And the fifth is in vitro diagnostics. In vitro diagnostics has always been a small segment, but it boomed. Disease detection became everything. This is going to play into the future in terms of all kinds of other diseases, because there's been a huge explosion on that front. In fact, the National Institute of Health Research in the UK has found that there were 1,608 diagnostics from 54 countries that emerged on the scene during the 12-month period when we were at the peak of COVID-19. So I think these are the 5 major trends which are going to continue on into the future.
Wonderful, extremely useful. I think we will go to the second session, but please feel free if you want to supplement each other. So we will keep it open discussion now. So I think that also takes us back to the question which Dr. Ramesh, discussed in his initial remarks, was about the role of preventive health in India. So because globally there's a consensus that the preventive health has to be strengthened in case you want to improve your health systems, improve your actually protecting people from falling sick instead of giving a treatment to ill person. So Dr. Ramesh, given your expertise and work in the government for like almost 3 decades, do you see things have changed on preventive health? And what do we need to really do in terms of focus areas? Where can we really focus in terms of improving the preventive health in India? Your microphone is off, Dr.
A lot has changed. I think COVID really called attention to the need for a more comprehensive, more integrated care. the preventive, promotive, and the curative services, which people thought were independent of each other. I think the importance of the outreach services, the paraprofessionals, has really emerged quite as an important instrument in the preventive care and also in the referral system. What really needs to be done is those grassroots systems that exist but are enfeebled and also poorly trained, they really need to be empowered at a fundamental level. We need to really refocus on building up that from bottom up. The second is the urban areas, and particularly urban slums and the urban poor had taken a major hit in the COVID. And I think we need to address that. There is no urban health in this country, actually, urban health system, other than the hospital care, apart from the metropolitan cities where the British built a health system. So there is a need for urban-based healthcare, which is completely an innovative opportunity that exists now, where the private sector, the public sector, the not-for-profits come together to build a new healthcare system. And just let me take one more point, which I think is extremely important, and it's been made by the other panelists, is the application of technology. I think today we are at that opportunity to apply technology for transformation of the healthcare. A platform that can be built which connects, virtually creates a digital health record of every individual. This has the potential for continuum of care, reducing cost of care, preventing repeated investigations. It has a huge returns on investment, and I hope, and my vision would be to see this, of course, with all the securities, all the privacy protocols, application of information technology, which perhaps blockchain and other new instruments, I'm sure can create this. And this is the investment where the public sector, private sector, not-for-profits need to come together. And that platform, I believe, would be the future. And the technologies which we talked about, the telemedicine, the telehealth, and the artificial intelligence, the robotics, this is the beginning of that opportunity, which you can really expand. And I think that has a much higher returns on investment, whether it is for the government or the private sector, in terms of the impact it would create than anything else. So you really create these paraprofessionals and those primary healthcare physicians and connect them up with this larger universe of technology-based healthcare. That is how I would see the future. And that obviously would generate the necessary data, enables us to have a predictive analysis, direct the resources where they are most required. We do not know what the real burden of various diseases are. There is an intuitive sense that something is more, something is less, but then several surveys are telling us perhaps our intuition is not always based on evidence. So necessarily these issues, I think, would have a huge opportunity. This is, in my view, is the tipping point. We must seize the moment.
Right. Excellent. And Dr. Rao, that takes me to you actually. How do you see the future hospitals? Will there be more doctors there or more technologists there? Like what kind of hospitals you see down, say, in 2040 or 50 globally, where things are changing? Like you deal with technology, you deal with surgeries which are completely supplemented by the technology, by the tools. And those were not available when you were in MBBS or you were doing your studies.
Absolutely.
How do you see the future hospitals in terms of the way they deliver the treatment?
Before that, actually, Syed, can I just, as an extension to what Dr. Ramesh and Mr. Sanjeev has told, actually, COVID portals, what is the government has initiated now, the first ever time we see public-private sector, we are able to get data. Leave the treatment part, but at least we're able to get the data. And as Dr. Radha said, it translates to preventive part. So suppose we have this COVID type of portals opened up for diabetes, hypertension, maternal mortality, pediatrics. Imagine the amount of data that we have, and whatever Dr. Radha is talking about drug development can be easily translated within India.
Right.
See, this data, I think we should take advantage of what we have learned from COVID and translate it to all other diseases. That is I think the government has taken a beautiful initiative. I think we should just extend this to all other important infectious diseases, hypertension, diabetes, maternal mortality, pediatrics. I think this will get a huge data from us, and then we can take some decisions from the government side. And as what Ramesh has said, we have to have evidence-based this thing rather than an intuition-based data to show that what is happening.
Right.
On the second aspect, actually, what you said was actually there are two aspects of this side actually. We have to keep in pace with what is going on. I mean, I cannot say that I cannot keep in pace with what is happening in technology. But at the same time, in a country like ours, which takes care of 70% of the people who are in rural place, actually, maybe it is very, very difficult to translate this into, take it to the rural India. But the way it is happening, actually, more and more people have access to this basically because of telemedicine, teleservices. And in future, as this becomes more and more ingrained into the medical field, I think the cost may come down. But whether I like it or not, actually, I have to go into robotics. Whether I like it or not, I have to use telemedicine. Whether I like it or not, I have to get into artificial intelligence. Without this, I don't think I can survive into today currently clinical practice. And it is not only surviving, we are competing with other worlds. Actually, COVID has taught us that we are competing with the rest of the world right now. We are way ahead of the thing. The only thing that we don't have is data from our Indian country. That is all objective. We don't have, I mean, subjective. We don't have an objective.
But Dr. Rao, what about, say, for example, your hospital? Are you capturing data, and how are you using that for decision making? Has that?
Yes, yes. Actually, we have heavily invested on data capture. We have heavily invested on all the data that we're getting for each and every patient is being tracked right now. Actually, we have been very, actually, Ramesh knows about it, actually, Sanjeev knows about it, and we are trying to get this coordinated with at least the centers which have this facility so that we can pull the data together. We are open for this, actually. We have invested huge amounts of this, and if you see the last 2-year data, I don't think we can have so much of data that is available. And we have very effectively translated this onto basic science research. Basically, we are able to see, track these patients. We are able to identify this thing and then translate it onto some basic research also.
Right. Sanjeev, that again takes me to you. Like who you see investing in technology in India? Like who's investing? Or who do you see will invest more? Is there a pattern? Particular companies are more willing to invest, or particular states are more willing to invest and some are not? They don't see like a value on investments in technology.
I think, if you look at where we are getting the projects from, I'll be very, very practical.
Very good, yeah.
We are getting the projects from the hospital and also healthcare providers like Dr. Rao, who are very advanced in their vision and in their ability to foresee things. But at the same time, if you see some government initiatives, they have started with something. I will not say that even initiatives that the governments have started 3-4 years ago, also they're in the state where you can actually say that no, they are fully being put in use and the data is coming the way it's supposed to come. There is a gap between the intention and ultimately what is the outcome from those initiatives. It's happening across different states. I will probably can comfortably speak about Telangana, Maharashtra, and probably Andhra Pradesh, because these 3 states I know. I think we are, compared to other states, are I would say well ahead. Telangana and IP both are well ahead. Having said that, there is still a lot of opportunity though. Primary spending the initiative has to come from the public health, it has to come from the government. Government then absolutely must partner because they cannot do it by themselves. They have to partner with the private providers. So there got to be a technology companies, healthcare providers, pharmaceutical companies, medical devices companies working with the government to come up with a system. For example, technologies like 5G, telehealth, video consultations will be meaningless if your network speeds are low. You come to a district place, Adilabad, see your tiny small village, you want to set up a video consultation. No, you cannot do that. You will only have to do mobile consultation. You have to send doctors once a week. Video consultation is not available. So can we really have the basic infrastructure that is required for video consultations so the telemedicine to work? So it's the first initiative, because that will increase the accessibility. Those are the most vulnerable sections of the society. They need a lot more accessibility. We still see in news in Inadu and other places, where people have to walk carrying the patients for some kilometers. That's a basic, health is not it has to be fundamental right of every citizen of every state. So I think that's where government has to take the initiative. That's one. And second, once we have a cloud, connect that with the cloud, or the cloud is hosted by government or hyperscaler or somebody, but that will give you the platform wherein hospitals are not burdened with maintaining their own IT systems. They can focus on healthcare while the IT technology companies can take care of their IT systems. Now, wearables, IoT devices that Mr. Radha talked about, I think those will definitely help capture a lot of parameters around patient care. In fact, can create a connected healthcare experience from the time person comes onto the planet. You actually can monitor, track what's going on, and that way you actually can predict a lot of things about that person even before they happen. You actually see a lot of parameters before the diabetes actually sets in, and maybe starts advising on the nutrition, the healthcare, health lifestyle. That kind of helps with the preventive care. Preventive care helps, brings down the overall load on the healthcare. I think, to me, technology, if adopted properly, deployed properly, and companies like us will be more than happy to help. But there are a lot of companies, not only us. There are India. We are the source for a lot of global hospitals, global healthcare systems. A lot of services we do from India. I think it is high time that we leverage our own people, our own companies to build something that's more meaningful for the country.
Wonderful. Radha, how do you see, as a tech company, as a diagnostic company, what are the challenges of operating in India?
So, Sai, tech adoption in India is still a challenge. We innovate, we build devices, and then the success of these new paradigms really depends on adoption. But I'll say two things. One is that through COVID-19, we have learned to make these experiences more consumer-oriented, more patient-focused. It's no longer enough to say, okay, here is a connected BP device. Now you need to simplify it. You need to, think about how the cuff is going to be more user-friendly, because it's not a trained medical professional who's going to be using it. So there's in the medical technology, in the medical device industry, there has been a paradigm shift to say, how can we be more consumer-focused, more patient-centric design? How can we introduce all of that so that it becomes, so that technology is adopted by people more easily? But on the other side, we're also looking at how medical professionals adopt the technologies, and that is also not something trivial. So what we find is that there is a certain bar, all the standard things apply, accuracy, precision, these kinds of things have to be established. But there's no uniformity in the way medical device manufacturers or innovators develop these kinds of devices. We are still a nascent nascent ecosystem from a regulatory perspective. So we need to introduce certain uniformity. We need to introduce certain types of guidelines to medical device manufacturers, any technology manufacturers, whether it's software or hardware or a combination of both, so that doctors see the value and are able to adopt to it. The third thing is that we have to go the extra mile and establish the use case. So for a doctor to see value in something, it has to be clear how the patient is being benefited and how the doctor is being benefited in return. Otherwise, innovation simply lag. We can't bridge the gap. So those kinds of clinical research, clinical studies, research studies, where we also partner with academia, we partner with doctors, with hospitals, and so on and so forth. Those are very critical. What it will do then is it will serve as a filter. Very quickly it will become clear that certain types of innovations are acceptable to both sides, and then they grow and they go on to dominate or whatever it is. But we need these kinds of partnerships to very quickly identify those innovations which are worth pursuing, and we need the medical community and the users to really have an open-minded thought process, so that adoption becomes easier. So I would say adoption is one of our major challenges in India. technology.
We're also like, I request those who are joining us on YouTube as well. If you want to put a question, you can put a question, and my colleague here, Surabhi, will read them in the next phase. Dr.
Syed, may I add one more point, or do you need to move to the other?
Yes.
Yeah, so the other thing is that as we leapfrog and adopt more and more technologies, we worry greatly that those who, that there's this digital divide, and those who don't have smartphone literacy, those who don't have access to the internet are going to be left behind. And this is where I think government plays a big role, in that what we would have to do is rethink our public health system. For example, primary health centers could become hubs for technology, and they can then become places where advanced care is accessible to people, even though they may not individually have the means to do it. So I think a certain amount of rethinking is required on that side in order to bridge the digital gap.
Yeah, no, I think that will certainly, it takes me to, another question of, India is still a developing country. There is a huge chunk of population which is extremely poor, and they need a lot of support in terms of moving up in the ladder. But we are seeing in the health situation, particularly when someone is ill in the family, eventually the whole burden of treating that person eventually comes to that individual and that family. And given also that majority of population in India is still not insured. There's no medical insurance cover to them. And that, given now, because if there are diagnostics available, but they don't afford it, even if it's like a couple of hundred or a couple of thousand, the problem will be the gap will certainly be bigger and bigger if we don't address it. So Dr. Ramesh and I think Dr. Rao as well, I would seek your comments on how can we improve the insurance covered in India? Whose job should it be? Like, is there a way we can improve things, given right now huge majority of population absolutely have no medical insurance? Yes, Dr. Ramesh.
Okay, thank you. No, that's a very important question. And let me address this by saying that, we have not resolved a very fundamental issue that many of the developed countries have resolved long ago. I mean, there's no political debate on the matter that health is a public good and it has to be publicly provisioned. Health, education, nutrition, there's no, whether it is capitalist or communist countries, all have agreed on one thing. Now, I mean, people will be surprised to, I'm not sure how many are aware that 48% of healthcare costs in the United States are financed by the government through Medicare and Medicaid. And the rest, the insurance companies themselves have brought a huge ecosystem. They've created an ecosystem in terms of quality of care, in terms of standards of care, in terms of the performance protocols, and the professional entities, professional agencies have made a huge impact in terms of setting standards, enforcing them. These are not done by the government. These are not done by the private sector. So, I mean, they all have come together. So in my view, today time has come for India to embrace the idea, all political parties across the spectrum, that health is a fundamental right of all citizens. Access to quality, affordable, accessible care should be a fundamental right. And those who could afford to pay, and those who are employed, the employee must take an insurance. And those who cannot afford to pay, the government must finance that care, whether it is through the private sector or the public sector. Now, we are somewhere in between. I mean, we've created this PMJ and we created the Arogyashree. Each of them really have written with multiple imperfections. So in my view, it is incumbent on the government to provide universal healthcare, and those who cannot afford ought to have access to that quality healthcare. Now, let me add two more issues. I think this is the real time for this difference between the governments and the public sector, private sector, and the other institutions. I think this is the time to come together. Certainly the government needs to bell the cat, no doubt, but there has to be an advocacy with the political parties. The politicians perceive health as a hospital care. More hospitals, they think the problem is solved. And you lay a foundation stone, you cut the ribbon, and that's the end of the story. Dr. Rao will tell you I mean, you know, managing the hospital, I managed Nizam's Institute for some time, and I know it's most complex management challenge. There are a million things that you are required to do, and it's 24/7 challenge. So what I'm trying to say is that this is the time really that we need to look at the entire ecosystem. The health is an integrated responsibility, citizen, civil society, private sector, public sector, technology, entrepreneurs, not-for-profit, and data managers, thought leaders. They need to come together and say, let's create an autonomous platform.
Right.
And which will have everyone.
Right.
And so this in turn would create this sort of a framework in which whoever has a higher value would really contribute to that. But I believe the technological application, which opportunity which exists today, which didn't exist 10 years ago, and which is likely to evolve further. And I think that if today is the time, what happens in the government is they would say this is the electronics department or IT department, or this is the health department responsibility. You need a trans-departmental transformational healthcare institution, an authority at the national level, at the state level, which really brings all these different elements together. Without that, we will be having the same conference 10 years later and talking about reimagining healthcare for 24.
Do you see that, you know, we still are around 1% GDP on health spending? Do you see that figure changing in next 5-10 years? Any indication of things are improving that way?
If you ask me, I mean, having been finance secretary for a very long time, 5 long years, you know, I try to double the budget allocation for Andhra Pradesh government to the health department as a resource allocation. We increased it from somewhere 4,000 crores to 8,000 crores. The investment per se does not really translate into outcomes. Now, it needs a whole lot of other ingredients in order for money to improve. That's number one.
Yes.
Sorry. Number two is, you know, today our fiscal system is so stressed. All the states are over leveraged. The government of India itself, the fiscal deficit is ballooning. In this context, and this is why it is important that people do not believe that investment in, let's say, healthcare is a capital investment other than the building part of it. This is how the government classifies in its accounts, that the health care per se, the services are not classified. Now, they need to recognize that every rupee investment in healthcare, let it be IT technology, let it be human resources, whatever, capacity enhancement is investment, is a capital investment in the future of humanity of this country. We want our citizens to be productive forever. We want them to realize their full potential.
Right.
And if we are not enabling that potential to be realized, then we will be suboptimal in a very, very long time to come.
Right.
So this is the opportunity, in my view, for everyone to come together and then have the system that addresses the universal healthcare. Universal healthcare as a fundamental right needs to be enshrined in the constitution of this country. The political leadership needs to commit to that, and everybody must advocate this. That's my
very valid point. I wanted to ask quickly, Dr. Rao, do you see, because of medical insurance, a lot of people actually just do not have access to healthcare? They leave you hospital saying, no, we can't, even it's a very modest amount, we don't have the money and we don't want to get surgery done. Is this happening, and do you see things will improve in future?
It's a very good question, actually. This very rightly, I agree that health is the birthright of every individual. We should somehow make sure that everybody who is in need should get benefited by this. Insurance seems to be one thing. Actually, it could be the government insurance, which have been very popular in AP Telangana, and also the national insurance scheme that has come. I think that has immensely benefited a lot of people. There is no doubt about that. And also the private insurance companies are going up. The way it looks, actually, it is going to be an insurance-driven medical practice like what has happened in the West right now. That has got its own positives and negatives. I think we should somehow, I mean, I cannot discuss this in an open forum, the negatives of the insurance, because slowly it is going to be an insurance-driven thing, and the insurance companies are going to dictate what has to be done, where it has to be done, how it has to be done. That would have a lot of implications on medical practice, and the doctor-patient relationship would slowly dwindle to a different level. That is my. So I think we should have some sort of this thing wherein what Ramesh has said is absolutely right. But giving an amount is different, but it has to be absolutely translated in a right way to the right person in the right place. Then only I think it will get benefited. Otherwise,
Sanjeev, what we're having the consensus, like as Dr. Ramesh and Dr. Rao said, often there's no maybe shortage of money with the government. They can spend money, but somehow it still does not move things because perhaps they don't maybe identify the areas where they need to invest in technology. How do you see like future-proofing technology? Like, how do you see that concept with healthcare providers? Because if they invest money into a particular technology and 5 years later they feel like, oh no, this technology and this tool has changed, they need to buy something else. When you as a tech company and technology company look for a future-proofing technology products, how do you see that happening in India?
I think it is, it has started to happen already. So the overall pricing model for the technology, it is not going to be, a capital investment, upfront investment. That type of model has changed. It is becoming more and more subscription-based, outcome-based pricing. So it means, for example, you subscribe to a service, ERP as a service, or data analytics as a service, or your 5G network as a service. So basically, anything as a service is a concept that will make sure that you are always upgraded with the latest technology that's out there. So you are paying for the service. So technology as a service is what you start consuming. Then you are absolutely future-proofed. Whatever next technology evolution that will happen, that will be made available to you as part of the contract that you sign. It is 5 years, 6 years, 10 years, whatever the contract. So that way, every time the technology changes, you don't have to change anything. So you would automatically be updated.
Sanjeev, why do you think a technology will make a fundamental change in Indian healthcare in the future? What is the one area or two areas where you really think that they will really transform?
I wish I could say 1, 2. I think there are more than 1, 2, but since you are giving me 1, 2, I think the fundamental thing is the patient, the EMR records and integration of the EMR records, because that's a basic thing that we need to have. And second, in terms of accessibility of the healthcare to the people who currently don't have access, because most of us, even though 25% of our population lives in metros, but what about just 75%? And again, just quickly on the topic of insurance currently covers only hospitalized expenses. What about the outpatient expenses, which is almost 60-65% of the overall healthcare expense, right? Mm-hmm. I think that needs to be considered as well. Like governments have mandated CSR funding. Can they also mandate some kind of thing for the profit-making companies to maybe contribute 2-3% of your profits to the healthcare of the country? I think, absolutely agree with Dr. Jivi Rao, because, US, if you look at Obamacare and what the subsequent government, what they have done with the care, it's a insurance-driven healthcare can be a challenge. So I think there are pros and cons, needs probably larger debate, but yeah, absolutely agree. I think we have an opportunity. Our model can be somewhere in between, but I think individual choice and the hospital, the right care is only ensured if the doctors are making the choice of the healthcare and not somebody else.
Dr. Radha, how do you see the question of affordability? Whether you got excellent products, diagnostic products, which people can use even at home. I saw your product for the elder people, and imagine we are going to have almost 200 million people who are above 60 by next 2-3 years. And these people are alone because the structure of society is changing. They're at home. Who's going to take their diagnostic test or check their BP or remind them about next pill? So you're providing these products out there, but how is the question of affordability for a company like yours? How does that fit in, and how you're addressing that question?
So, Syed, I'll offer my viewpoint slightly differently, which is that I think that the technology revolution is having a very huge impact in an area of medicine which you could broadly classify as early detection. And early detection means that the cost of care, cost of dealing with morbidities, mortality, all of this will come down as a result of early detection. I mean, that's the basis for cancer detection, for other kinds of chronic diseases as well. So the kinds of technologies, the devices that we have developed, which enable, people to track themselves, to watch their, to monitor their parameters and so on and so forth, and to identify trends, etc. All of these contribute towards identifying something early and thereby reduce the cost of care. So our devices are indirectly having an impact on affordability for for society as a whole, because they are able to help people sooner. And I think that this is, if this can change, if technology can change this one aspect, it will be a revolution in society, because it's much better to identify and detect ahead of time than to have the best care systems in the world to treat. So
Wonderful.
that's my take.
Wonderful.
Thank you.
Very well
Thank you
said,
so much.
Dr. Rao.
Yes, Dr. Rao, you want to say something?
Actually, very well said. Actually, what you said is actually a penny spent on prevention is better than a pound spending on cure. I think what you said is absolutely right.
Okay, with that agreement on note, I think we were just moving to the question answer session. We have a couple of questions, and I request my colleague Surbi, if you can read the questions. We could maybe
Sure, thank you so much, everyone. I think
7 minutes for the question answers. Yes.
Yeah. Thank you so much, everyone. I think there are quite a few questions that our participants have put in. So we will try and take them one by one and address all of them depending on the time. I think our first question that we want to take is to Dr. Rangarajan, which says, how can we bridge the urban-rural divide as far as the digital health diagnostics is concerned?
Yeah, if I request everyone to be brief in their response to that.
Yes. In fact, I touched upon this briefly to say that the biggest fear right now is that there's going to be a digital divide, and we have to bridge that. So I think in rural areas particularly, the government will have to play a central role. And instead of having individualized digital technologies, there'll have to be hubs that are created, which become places where people can access various diagnostics, devices to measure parameters and so on and so forth, and overlay that with communication, EHR, EMR. All of these things will have to be really supported by the government, because we will not catch up in the rural areas, both in terms of digital literacy as well as in terms of penetration of technologies, unless there's a proactive spend and a commitment to taking things to people in the rural areas.
Thank you so much, Dr. Rangarajan. The next question here is, which is actually, all of us are facing, is COVID had stagnated a lot of other health emergencies and research like tuberculosis and cancer and a lot of other ailments. How do we make sure we build on this enhanced awareness and make sure that we catch up like really well?
Dr. Rao, maybe the question is essentially, there's too much focus.
The question is not very clear. Can we?
Yes, Dr. Rao, the question is essentially if there's a lot of focus on COVID, but other diseases in the middle of it got neglected.
Yeah, absolutely. You're very right, actually. But we've actually, most of the hospitals have learned the resource management very well. Actually, now there are two separate areas in any hospital that you think actually during the height of COVID pandemic, actually even people never ventured to come to the hospital for non-COVID diseases. So there was no other option, but we were not treating those patients. But once it is opened up now, all the hospitals actually had a separate COVID area and a non-COVID area, totally being segregated completely, so that apprehension of getting in touch with those patients is not there. Second, actually, what was rightly said, actually, there is people with malignancies especially have lost in their COVID time. Those people who could have offered cure ended up with palliation at the end of the COVID. This is one. And the second thing is a lot of patients, even on non-malignant things like hypertension, diabetes, actually, we see a lot of these patients who have missed their routine consultations and adjusting the dosage of medicines, leading to some increased morbidity that we're seeing right now. And the surge that we see immediate post-COVID is slightly basically the increased morbidity that we're seeing in non-COVID patients of these essential diseases that we have had.
Right.
Cancer, hypertension, diabetes, yes, all these things actually we are seeing slightly more morbidity in this patient, I think, but it just takes very short time to get this rectified. But malignancy, but even during COVID times, there were a lot of apprehension, but we made sure that follow the COVID protocols, and all the patients who came forward to get themselves treated were being offered. So that has changed in the last 6 months or so, right?
Yes, visibly so. Yes, thank you so much. This one's for Dr. Ramesh. It says that you spoke about opening hospitals and facing management challenges later. Is it a problem of lack of healthcare professionals rather than infrastructure?
I think it's a problem certainly of shortage of healthcare professionals and well-trained healthcare professionals, and more importantly, paraprofessionals, the nurses and the technicians, and so who are equally more important. Actually, in fact, the nurses become so vital and more than the doctor in hospital care. So, and more importantly, we have so few trained health managers or hospital managers in this country. One of the major problems, as I see, is that there are so few health policy managers, though there are a lot of thought leaders, but in terms of actual policies, there are very few people with experience and expertise. Experience anybody can have, but the expertise and hospital management, Dr. Rao would testify, is a very complex challenge, and government simply does not have hospital managers. They have superintendents of hospitals who are surgeons, physicians, pediatricians. They're good at they're good pediatricians, but not necessarily good hospital managers. And same thing with the district health management. District health managers raise up directors of health. So, I mean, no offense to them. I think there is now also need to look at this very, very seriously, the entire health professionals and the managerial skills, and much more important, even primary health physicians have so few skills to manage primary health care. They're not trained for that. And so
very good point, Dr. Ramesh. I think very good point. I think it's a very I think it's across the country as well.
Yeah. So
there is one point actually to what Ramesh has said actually. Now, COVID has actually been talking about less number of doctors, nurses and all. One thing that actually, I don't know whether we have observed or not actually, a lot of senior clinicians stop practice. They don't want to get back to practice.
Correct.
So we're losing patients. A
Correct.
lot of nursing staff stopped nursing practice, went back to the thing, changed their profession completely. So post-COVID, on one side, we have learned how to deal with it, but we have lost a lot of manpower, be it on the clinical side or the paraclinical side. So it takes time for us to, there'll be a lot of scope for the nursing, the technical staff. There's all absolute shortage of these people because a lot of them have quit their profession because they didn't want to get associated with COVID. I'm surprised, actually, I myself know a lot of senior physicians, surgeons who have completely stopped practice and they don't want to get back into practice now.
Right.
Thank you so much. Thank you. The next question is actually for Sanjeev. So data sharing between hospitals in times of pandemic is still a challenge. Is it all about trust?
Yes, I think to me, it's always privacy of the individual, and then the data protection concerning, with the data going to the wrong hands is always a concern. From that perspective, right level of data to be shared with the right level of agencies. I think that means, we don't really have a data regulation policy that kind of addresses this. I think though that's why it has to be a regulatory framework has to evolve along with the technology deployment. So if I think the right data, individualized data need to be shared probably only within the hospital or with the doctors, whereas the slightly higher level aggregated macro level data need to be shared with the government agencies. And so I think that debate has to happen. I think maybe there are laws which I'm not already, because maybe Ramesh probably you could comment, but I do not know that something already governs. If not, then I think that data framework or the regulatory framework has to be put in place first before we can say, data can be shared. Interoperability from the regulatory perspective is this, but then second, are the systems compatible with each other, even if you want to share the data? Today, a lot of data is being shared because we are either sharing information through some files, emails, and somebody is inputting the data to a large extent between, let's say, primary institutions, primary care to the district hospitals to the. So there are portals, government people. Some people are going, healthcare workers are going and entering the data manually. The data transmission is not happening the way it's supposed to happen between the two systems. For that, is the technology available? Absolutely. There are open source systems available. There are proper protocols established that can potentially seamlessly integrate the systems, but then that needs to be put in place. So the integration, if it's put in place, I think it will happen.
Sorry, there's also a quick question related to this actually. How do you see role of Aadhaar in the data?
I think if you look at in the United States, social security number is the one that governs a lot of things. So we need something ID, one unique ID for each individual. Now, whether we call it Aadhaar, because some people might have some resistance against Aadhaar, but you can call it whatever. But unique ID for an individual is required if you want to track the data related to that individual on a seamless basis across different systems.
Agreed.
Yeah.
Thank you so much. Thank you, Steve.
Syed, if I may just add,
yes, please, yes.
Ultimately, it all boils down also to the trust between the citizens and the government. This certainly needs legislation. There's no doubt at all about that. However, Aadhaar is a very powerful instrument that is available. But then there's so much of mistrust and potential for misuse. And the government is so opaque about this. So this is what creates the problem. So, such an opportunity is being missed. I think just because of this, we've not been able to create this trust. And that's also reasons for that. Having been in the government, I know that there is always a temptation to misuse the data by the government, not by the individuals. So, these are the challenges I think the society as a whole and the political leadership as a whole has to address.
Sabi, any more questions, Sabi?
Yeah, I think we'll take just a couple of them more. One of them being...
Maybe two more, I think, yes.
Sure.
Yeah.
Usually hospitals have very less budget for technology. How do you suggest that it can be overcome looking at the present scenario?
Dr. Rao? Or maybe Sanjeev, you want to take that?
Actually, I think this technology is basically cost-driven. Basically, what happens is every hospital wants to get the technology, the latest technology, to translate into clinical practice. But this technology comes with a big tag. And the technology is mostly from the West, and which has a huge price tag on it. But we see a lot of them coming up, like what Dr. Radha said, which are being developed within India. And the price tag comes down, like what has happened for some of the diseases that we have seen, cardiology and others. I think it is just a matter of time that India starts making its own thing. And then we are less dependent on what we're coming from the other countries. Then technology is very easy to incorporate. And I personally feel India is going in the right direction. We have, as in today, suppose if I want to get technology, I have 3 options right now, which was never there a decade back. So we have an option to choose. But I think because the SOPs and the standards are not absolutely to the mark, I think we still opt for some of the technologies from the West. I think Sanjeev will also accept with me. But I think it's just a matter of time before I think the Indian companies make these technologies which are on par and deliver the equal effectiveness. I think it's very easy to incorporate into clinical practice.
Wonderful. Yeah, so we last question, yes.
I think we'll take the last question. And there are a lot of other questions, and I would request all our participants in here that what they can do is they can write to us, and we will ensure that we will get back to you. My colleague Shivali will post in her email ID in here, and we will actually write back to you. Because of the paucity of time, we will not be able to take all the questions. The last one here is about the medical education being really expensive and making it difficult for the people to go through it. How can we put a check on this?
Dr. Ramesh, you want to do, or Dr. Rao?
No, yeah, no, I think there has been this belief, which I do not subscribe to, that we have serious shortage of doctors. it is maldistribution of the doctors and suboptimal trained doctors and doctors not trained for the primary health care. I think that is the challenge. And I think the government has responded in an incorrect way by exponentially increasing the medical seats now and making it more increasingly expensive. Now, I would foresee 10 to 15 years from now, there would be a huge frustration among those youngsters who have spent a lot of money, trained to be doctors, and then obviously they are investing this money, expecting returns. It may not be realized, and it will only drive up the cost of healthcare, already hovering around 6 to 7%, growing 18 to 20% year on year. Now only 1% of that is financed, only 20% of that overall pie is financed by the government. So I see this as not what is the right prescription for the country. It applies not just to the medical education, also nursing education, paramedical education. So this is an issue which has not been discussed. And the curriculum for the training, the way the doctors are trained, it is still the way that it used to be trained 70 years ago at the MBBS level. So I think it requires, and it's medical education is really in a bad shape. I mean, Dr. Jivi Rao knows better.
Dr. Rao, you want to make a comment about it?
Yeah, what you said is absolutely right. Actually, education again should be a basic right of every individual, but as in today, it seems to be taking a different direction, basically because of the policies of the government. Actually, see, suppose you take some of the other countries, Western countries, where the complete medical education is on the public side. Very few private medical colleges offer these things, actually. But vis-a-vis compared to what is happening in those countries, suppose if you take what's happening in our country, mostly the private medical college or even other private engineering colleges are booming, actually. And basically because the standards of teaching in public sector slightly seem to have gone down. People seem to be asking for private sector. Private sector, obviously, it's a price tag. And these people, obviously, once they come out, they get frustrated. But this is a vicious cycle, actually, unless and until we have some system like what happens in the West, wherein the government takes the initiative instead of, or the government medical college should have some public-private partnership, and then we should offer some seats to the other people. Otherwise, this is going to be, and what Ramesh has said is right. I think that frustration is a very, very good word that is used actually among medical practitioners. And absolutely, everybody who comes out of the private medical college wants to stay in the metros or the two-tier cities, not to go to the periphery, and that makes absolutely maldistribution of the healthcare facilities.
Wonderful. Thank you so much with that. So that takes us to a last session of this, of this discussion, which is essentially what will be your, if I may ask you that way, what will be your one key recommendation to the Health Minister of India about how to improve, say, for example, medical education, medical policy, technology, and rather maybe diagnostics. So if I start with Dr. Radha with you, what will be your one key recommendation to either to the Union Health Minister or health ministers in Telangana and Andhra?
I would say that that primary healthcare in rural areas can be made highly effective by the use of connected devices and technologies. That should become a major focus. And this is an opportunity that presents because for the first time, we have an alignment between doctors and users and technology developers. So this is the right time to invest, create a completely new system of healthcare delivery, and take real high quality healthcare with all of the constraints that we currently have in our society to our rural population. That is really very, that is 30, 40 years behind the urban population. So my key message is let us use technology for public good, particularly with rural healthcare.
Sanjeev, what will be your key recommendation to the Union Health Minister or the ministers in Andhra and Telangana?
I think integrated platform connecting all the hospitals at the right level across different cities, metros, villages. I think it's the need of the hour that will help us predict, prevent the pandemics from happening ever. Scalability can be achieved only through technology deployment. Absolutely agree. We cannot just keep on increasing the number of doctors and by just lower standardized education, but rather if we deploy the technology correctly, then accessibility will increase, and also we can increase the reach of the doctors to a higher, wider population. So I think that scalability also can be addressed by deploying the technology. If we also deploy the technology that Radha was referring to earlier, which is to wearables, IoTs, the diagnostic devices, which are kind of smart enough to read what's happening before and then communicate with the doctors, that can help with the preventive care, lower the overall burden on the healthcare. So technology has to be the priority.
Dr. Rao.
There is one statement which I leak actually, which Ramesh and Sanjeev may like it actually. See, actually, we have a lot of medical information that is available on social media. Unfortunately, we are in an area of Google-acquired medical knowledge syndrome. I personally feel this is creating a lot of problem. We should have some way to tag these things. Suppose I am posting a post, it should be either mandatory that I tag it as personal information, or it has to be tagged by the social media, or you have to have some incorporation of AI to make this, categorize this. So it has to be a personal opinion, or it has to be a government scientific body recommendation, or an evidence-based recommendation, or an evidence-based opinion.
Excellent.
So this has to be automatically tagged. Otherwise, lot of information is misinterpreted, miscarried. I think this is possible with people like Sanjeev, Ramesh doing it. And it is very easy with artificial intelligence, or it could be mandatory on my part. I categorize this as, even now when I post, I have this thing, a public one view or it's a private view.
Dr. Rao, in fact, actually, WHO started from last year a global course for doctors on infodemic management.
Yes.
This is something we can do it
absolutely essential. This will lessen the stress on the medical fraternity to take the healthcare.
Wonderful. I think Dr. Ramesh, what is your advice going to be to your colleagues who you worked with in government, in Andhra or in the Union Health Ministry?
No, more than my colleagues, I would plead with the ministers of all states, and particularly the Prime Minister of India, to convene immediately a meeting with all the chief ministers of all the states and all the political parties, leaders of all the political parties, reach a consensus that health is a fundamental right of every citizen, and provision of access of quality healthcare has to be publicly provisioned, and it must be enforced by the Supreme Court of India. I think this commitment must be made by all political parties, and the rest will follow. Technology, public-private partnerships, the primary healthcare, all those are integral part of this. But I think there is need. All healthcare is political. The NHS came out of the beverage commission. It didn't come out of the medical professionals. So I think this is a political commitment, and politicians need to make this commitment.
It has to be. I think. Thank you so much. I think that's also the conclusion of this discussion. It has to be collaborative. It has to be tech-driven, innovative, and it has to be political as well. So it has to be politically an issue where there's a political commitment that health is important. So I thank you all for your time and really for this enriching and insightful discussion. I request my colleagues to take the session to the next. We have a flash talk session, but I thank you all, and stay safe and stay healthy, and we look forward to meet you again in another opportunity engaging with you in one-to-one level. Thanks a lot. Thank you so much.
Thank you very much.
Thank you, everybody.
Thank you. It's a fascinating conversation.
Thank you so much, everyone.
Thank you.
Thank you.
Really, thank you so much, everyone. I think the idea behind our summits is not to keep it at the discussion level and ensure that it gets implemented and heard by the right people and to make a difference in the healthcare systems. Thank you so much to all our participants. And with that, let's move on to the next session of the day, which is a flash talk session. May I now request Jisha Krishnan, who's the editor of First Check, to take the session forward and moderate it. Over to you, Jisha, with that.
Thank you. Thank you, Surbi. Hello, I'm Jisha Krishnan, the editor of First Check, the flagship fact-checking initiative of Health Analytics Asia. And welcome to the fourth edition of the Health of India eSummit series in Andhra Pradesh and Telangana. When we started this virtual conversation about 3 months ago, that was in July, it was a bid to seek innovative solutions, encourage new collaborations, and assist the country in its recovery journey. As we reclaim our lives and livelihood amidst these pandemic challenges, here's our earnest attempt to pause and reflect so that we can envision a better future for India's health. As we call it, we are reimagining the future. I believe that we can all benefit from some inspiration, particularly when it comes from innovators who dream big and make things happen. Today, we have with us three such inspiring entrepreneurs who have revolutionized the healthcare space powered by technology. Our very first speaker for today's Flash Talk session is Manish Ranjan, who is the CEO and co-founder of NanoHealth. As a seasoned technologist who has designed business processes aimed at driving efficiency and profitability for MNCs early in his career, Manish is striving to bring the same expertise in designing healthcare systems that can reduce the socioeconomic burden of chronic diseases. Through NanoHealth, his mission is to change the reactive and often fragmented healthcare into a more proactive, continuous, and coordinated healthcare model. Welcome, Manish. We are excited to hear your experiences and the roadmap that you are charting for the future of digital health technology in India.
Thank you. Thanks, Jisha. Am I audible?
Yes, you are.
Thank you very much for allowing to express my views. I think the first session was just stellar. I mean, we made a lot of points, and the only thing makes me a little bit sad that, you know, when 6 years before when we started the journey, we were still discussing the same things. I mean, but yeah, I mean, the world have changed tremendously. The COVID has definitely brought in the whole transformation of healthcare and made it a very, very fast pace. So yeah, it was great to hear, and I can, you know, it'll be a good segue where I can talk about some of the experiences and, you know, what are the possible solutions and potential solutions that we have been able to come up with to actually address the challenges that we talked about. So I think, you know, when we started the whole, when we look from a business process perspective, and, you know, I mean, I was lucky enough to see it very closely, my dad running his own hospital and, you know, seeing that what are the main challenges. What I realized that healthcare, and then, you know, reading a lot of books, which was written in the US about how the healthcare should be, while the US was considered to be, you know, decades ahead of a developing country like India, but you know, I mean, like how healthcare should be. And the two things that came out very clearly, one was that how the healthcare entire system is very reactive. You know, when I say reactive, in the sense that I mean, almost everything is left to the individual or the patients to actually determine that how they should take care of their health. When they feel a need and a pain, then they go to the doctor. Till then, our doctor is actually literally waiting for the patient to come, you know, and then, you know, of course, they do a great job into giving the prescriptions and all, but then absolutely no connect that happens after that between the patient and, you know, the doctor or health system. So basically, you know, which leads to very late identification of the diseases that we are talking about. I mean, especially, you know, diabetes, hypertension that we all talked about. And then, you know, the even follow-up is very late. So even, I mean, the enough number of people who, even though identified early, you know, they would not seek continuous treatment, and then that leads to further, you know, morbidities and so on. So, you know, escalation of the diseases, and that leads to serious problems. So while we are all talking about, you know, prevention, healthcare and not sick care, but, you know, there's some very basic fundamentals that when we started, we found it to be like, it's why it is so reactive. The other, when we say fragmented, it's like, you know, that today, if you go, so even if we are proactive enough and do a health checkup, right? Be it in rural areas or in urban area, right? Like our data says that even in urban areas, only 11% of the people who are identified as at high risk for some or the other disease even bother to go for a free doctor consultation. So we work with a lot of corporates, so so they don't follow because, and one of the main reasons is it's absolutely asymptomatic, like diabetes, hypertension, thyroid, lipid. They're absolutely asymptomatic. And I mean, just to stress upon the impact of that, at the peak of wave 2, the maximum deaths per day was 5,200 reported numbers I'm talking about. While today, every day, more than 8,000 people die out of heart-related ailments in India. So that's just to give a perspective of why COVID is definitely, and if you look at why it's COVID is more important than heart-related ailments, is because everything that happens in 14 years in heart-related ailments actually happens in 14 days in COVID. So the impact is a lot sooner, and that's what leads to that. So, and then basically there are tests written once you go to the doctor, then there is a follow-up that is done. There at times you need to visit multiple specialty doctors, and, again, all of that, it almost never happens until unless you are, let's say, in a hospital and the person is really, really very proactive about their health. So, it's again very fragmented. So when coming from the process perspective, we figured that what can be the potential solution to this. We also realized that solving one aspect of the problem, be it, let's say, only screening tool, right? I mean, that's not enough. I mean, in diabetes, it is said that 50% of the people are actually know that they are diabetic. Of all the diabetic people, only 50% of the people even do something about it. And out of that, 50% of the people are even in control, which comes out to be close to 6.25% of the total diabetic population. What can be done, right? So the first thing we realized that you digitize every aspect of the health, both from the health parameter and also from the operational perspective. So in the sense, you need to be screened first. It can be a very simple form because you can't go ahead and test everyone because it's expensive. Then, once you have been able to screen and you come at a high risk, then that is when you should go for a follow-up test, right? Then, only when that is done, and then you should go and seek a doctor, or, someone should, you should visit a doctor. And then, if you are confirmed with a diagnosis of a disease, then there is a long process that needs to be followed. Not nice, but, we don't have an option but to actually address that. So unless this entire 4-step process of screening, follow-up, lab test, diagnosis, and the disease management, as it is called, is not done, you can't. The impact will always be very fragmented and limited. So we went ahead and started the journey, and so what we did was, like, we at first built a system to digitize everything that happens within healthcare. So right from screening, lab tests, so to capture the entire lab information, to e-prescriptions, so that the entire prescription is digitized, and then there is a follow-up part, which again includes all of this. But yeah, so now anyone using our solution have the complete history of everything that has been happening over a period of time. So that's and then capture data. So what, right? If I know that my HbA1c or my lipid level is whatever lipid is 180 or 210. Like most of us, we don't know. Google gives you some information, but you heard the best of the doctor saying that don't go by that, right? But that's where this again we went ahead and we built what we call as a recommendation engine, where each of this digitized data actually goes to that, and you put pre-filled algorithms again, which are generated based on AI, and then it tells you what next should be done. So and then when we went out and basically started talking to, early on, like, okay, well, it's great, that's how healthcare should be, but how many of actual real takers? And there were, I can tell you that there were very few. And I have had my own, like any entrepreneur, my own sleepless nights. How can people just don't care about it? Everyone is talking about it, but no one is doing anything about it, right? And but yeah, we went to continue to be on that journey. Having graduated from ISB, the professors there really helped me analyze the impact of this. So we have a published paper which very clearly says that anyone who will use the platform, they could actually, reduce their diabetes and blood pressure levels by this much. So we did that, and when we continue to work on that, and then over a period of time, we also learned that the health value chain is very long. Like I said, like right from screening to actually disease management, it's a very long value chain. And it's a lot of different stakeholders are there. So unless you don't align all of them together, the impact cannot be at first measured, it cannot be counted. And then there are a lot of diseases as well, right? I mean, the COVID came, now dengue is troubling us. So basically and every disease care pathways, though well defined, is like completely different. I mean, it's very hard for one to cross train all of them. But then, so that's when we took a step back and we again, change our digital platform and saying that, okay, how can it address multiple diseases? Because if we talked about, like, there are diseases which are platforms or solutions which are very deep in one disease, but as someone who is diabetic, I mean, it's a 40% more chance for that person to be hypertensive as well. Where do I go for managing my hypertension, right? And if I get COVID, then what do I do? And so platform, because since the systems are not interoperable, so the guy who's going to a cardiologist, he can't see what happened, what was his blood sugar level. So I think, but all of this is kind of coming together now, and we see that a lot of activities are done. Interest has grown significantly. People have actually doing the adoption, even from the users have increased for telemedicine and likes of it, and because convenience plays a very important role. We are very proud to see the country, following NDHM. I mean, like, we get calls periodically from NHA that, hey, you are one of the integrators. I mean, how is it going? What's happening? Or when are you going to finish the entire, integration with NDHM? So we are definitely, working on that. And it's great to see the government being so proactive about actually doing it. And one of the problems which was raised in the previous panel, that, how do you make it interoperable, is actually being completely solved by NDHM, where every hospital, clinic, every provider will have to be able to supply and provide data for any other user in the who requests for data after the consent has been given by the patient. So I think so that's what we have done, been able to do digitally. So now I can proudly say that we have touched more than 500,000 people. We have a paper saying that it's not only about the screenings or lives touched, but it's actually the impact over a period of time has been immense. We have been able to show that by providing a good care, you can actually reduce your insurance claims. Employee or engagement of the users of the patients are very high when you use a platform like this. So it's great to see the change that we had envisioned, and and the front leaders talking about it. And we continue to be completely committed to the growth and scale that we are doing. We, as an entrepreneur, we took a risk, but it's always great to see that how we are able to actually make a real impact on the society. So I'll stop there.
Thank you. Thank you so much, Manish. And that was a very candid talk. And thank you for that. And also for so many positive takeaways. You also set the stage for our next speaker, who is the co-founder and the CTO of a deep tech health startup called Radiate. They make clinical diagnostic tools and decision support systems using advanced AI algorithms. The startup has interestingly been at the forefront of finding healthcare innovations working towards management and eradication of preventable blindness. Welcome to the Health of India eSummit series, Puneet Raj. The virtual stage is yours.
Thank you, Jisha. First of all, I'd like to congratulate Data Leads for organizing such a panel. It was very inspiring to listen to the panel. And also the speaker that preceded me, Manish. It was an enlightening talk. It is something that we have experienced when when developing our own solution. The term he coined, the reactiveness of the healthcare system, and the importance of digitization in solving it. He drove the point very well. And It's an immense pleasure and honor for me to be invited to share my thoughts on some of the current trends in healthcare and also share my work here. At Radiate, we are working towards a goal of beating preventable blindness and improving eye care in India. We have developed an AI-assisted screening tools, telemedicine platform that use the image of the retina captured through various inspection devices. It should be evident that similar to cancer, most people take notice of a serious issue in the eye only after they have experienced significant signs of deterioration in their vision. By this time, the management of condition might be at a level of surgical intrusion and might come at a steeper cost. Among the eye conditions, cataract, leading cause of preventable blindness, and 80% of the blindness in India can be prevented. So the chance of developing a serious eye condition is further increased in a diabetic person. And India also hosts second largest diabetic population in the world. And also the prevalence of blindness in India is 2%. So therefore, it is recommended that every person above 40 takes an annual eye test. And in case of diabetes, it becomes even more crucial to keep track of changes in vision. So this can happen only if eye care solutions are available in every PHCs. That is currently not happening. They are isolated with, like you have to go to an eye specialist to get a specialized test done and get their opinion. The challenge is that there are millions in number of patients. The doctors are in thousands, and specialists, and especially eye specialists, are in tens and hundreds only. And in cases of glaucoma, there is also limiting factor of high cost of diagnosing tools. There are many other such eye conditions that require high-end devices. And it is further exacerbated in tier 2 and tier 3 regions due to obvious and more compounding factors. But I think we are at an opportune juncture of time where the advancement in AI algorithm and wide access to technologies such as cloud has enabled democratizations of key resources for development of solutions, especially AI solutions and web-based solutions that have enabled rapid development of cutting-edge innovations. The smartphone and IoT technology, one of the panelists was said, the importance of connected devices. So smartphone and IoT technology are also one of the leading tools that are being extensively used for improving healthcare. Also, the increase in penetration of internet in rural areas couldn't have come at a better time, especially for healthcare innovation based on IoT, and it has opened doors of applications in rural areas as well. In Radiate, we have developed solutions making use of smartphone and IoT technology to make the medical devices that we develop more portable, smart, and low cost. The algorithms developed through deep learning, and it is the state of art, and it is the accuracies they match of the specialists, and it is a very obvious trend in most AI technologies that they can reach a specialist level, but it depends on how you actually use it. And it is thanks to the use of cloud, use of the latest and greatest tool in software development at this point, such as for rapid development of software using React, rapid deployment using Kubernetes, etc., that we are able to develop solutions at a lightning fast pace and deploy it even faster. The space that we are aiming to conquer presents many interesting challenges. The data is obviously the key in developing AI algorithms, but the devices currently used in healthcare providers, they have limited capabilities. They use legacy hardware, legacy software formats to store them. So that is big issues in case you want to collect data. So there are many ways to get around this. One is the development of and deployment of devices that already have IoT enabled with them, and we choose to develop such devices because though the IoT enabled device hold the key for the future for us. Getting the data for AI involves interacting, good for AI involves interacting and convincing the doctors to engage with technologies that might be unknown to them. We need the doctors to annotate the data, and we do it typically through a web app. And this experience is usually for a first-time user, it's not very user friendly to them. So that is why we have decided to develop our own web apps, keeping the doctors in mind and their convenience in mind. And we use the smartphone as our preferred choice of platform. Typically, if you are annotating a high resolution image, it is preferred that you choose a laptop. But doctor, if you keep in mind the convenience of a doctor, he might not have a laptop ready at any time. But in case of a mobile device, he can always zoom into an image, annotate to the best of his ability using his time very effectively. And this greatly enhanced the engagement of the doctors with our processes. And you might think that developing the algorithm is the hardest part, but it is actually a part of the end solution. That is proving and testing that needs to be done, and we need to get a gold standard data and to effectively, usually for such an undertaking, huge amount of data and best quality of data, we have to establish a good connect with the doctors, and the doctors have to have a good opinion about the technology as well. So you're finding such doctors is a challenge, but if you find them, it is very important to establish a good relationship with them. And establishing such a relationship also opens a lot of doors to a startup, because usually these doctors are also very well connected with their network of their own specialty. Finally, and most importantly, the solutions should make economic sense to the users, to the healthcare providers, the doctors. It should also have a solid medical ground, without which no healthcare provider would be willing to touch the solution. The government holds the biggest key to for a quality healthcare delivery, and we have seen that digitization process has greatly helped in India's battle against COVID. And I would recommend the government to further the process of digitization with ample security in all its PHCs. And like many of the panel members did point out, that there's a need to not only for COVID management, for any other disease management, digitization is a pretty important part. And for the vision of India's healthcare for the next few years, I think better integration and more penetration of technology holds the key. Also, there is a huge need that the government improves the standard. For example, when we talked about the vaccine, there was an issue with certifying the COVID vaccine developed in India elsewhere. So those kinds of issues can be brought down as less as possible. And it is very much possible, very much in India's potential to do that. And I think we can see implementation of blockchain to manage patient records would be a very effective technology solution. I think it should come from the government side, especially to manage the insurance and patients' health records. Implementation of IoT-enabled devices is going to be keep on increasing. We are working on eye care, and every part of the body. I think some startups will be working on an IoT-enabled devices. So that's really the future. And I think digitized care of the patients is the key for a better healthcare in India in the future. That's all I have for you now. Thank you.
Thank you. Thank you, Thank you, Puneet. That was a very insightful talk. You really took us into the workings of a startup working with AI, because as you rightly said, it's not just about the technology, it's also about the people who are going to be using it. Finally, we move on to our final speaker for today, who will be putting the spotlight on a fascinating subject of how personal genomics tools can make personalized preventive healthcare a reality for the average Indian. It's my absolute pleasure to welcome Anu Acharya, the CEO of Mapmygenome, a molecular diagnostic company that aims to make people proactive about their health. Unfortunately, Anu couldn't be with us today, but she's been kind enough to record her talk so that we can share it with our audiences. I request my colleague Shivali to please share Anu's talk.
Hello, everyone. I'm Anu Acharya, and I'm the founder and CEO of Mapmygenome. I think the first thought that comes to our mind when you hear the word Mapmygenome is that how do you map your genome, and what is the genome in the first place? So I think just to get a little bit for you to get on to understanding what we do, the first and most important thing is that our body has a lot of trillions of cells, and in each of these cells, we have genetic material that we have inherited from our mother and father. And that is what we are looking at. We are looking at the DNA that will code for a lot of what the cell and what our body ultimately does. So when we say that we map your genome, we are basically saying that we are able to read that sequence of the letters that are there in your DNA, and we are able to not just read it out to you, but to be able to look at associations and look at the way that that can make a difference in your lives. So today, let me start off by presenting a little bit on that. So when we look at the future of genome mapping, and I just talked to you about what we are doing with genome mapping, which is to be able to read the sequence, but to be able to make the kind of understanding on what that mapping is going to do in terms of understanding of disease risk, understanding of where you came from, understanding of what drugs will work for you, and understanding of your nutritional profile, understanding of your fitness profile, and many more things. But ultimately, it can also lead to getting us to better drugs and many more such things. I'd like to start off with a quote by Isaac Newton, which says that if I have seen further, it is because I'm standing on the shoulders of giants. And the reason I mentioned this at the beginning of the presentation is that when you look at genomics and you look at what has happened over the last many years, ever since the human genome got sequenced, and even many years leading to that, it was all the research work for a lot of scientists that had put in, and ultimately we were able to develop on top of that we can actually come up with a viable solution for everybody. And I think as we go along over the next 5 to 10 years, we'll see that all the work that is being done today will become the basis of what everybody will be working. So if you look at Mapmygenome early days, this is my second startup, and my first company was called Osmum Bio, which I started in the year 2000, just around the time that the Human Genome Project was getting completed. We had become one of the largest genomic services companies worldwide. We had labs in the US, in Germany, and in the Netherlands. And when we did all of that, one of the things was that we looked at the 3 main problems that were coming up. And one was the fact that while the world was moving towards the whole personalized medicine, there was lack of Indian data. There was no focus on prevention, and it was an expensive technology. So what we ended up doing was to be able to create value so that we can actually do something where consumers will be able to do this test on their own, and we are able to then take that test and be able to use that data to be able to then do the associations and thus build machine learning on top of that will help us build a much more robust way of being able to do risk analysis for understanding what your genome is actually saying. Now, when you look at the future, we wonder what the future is going to hold for us. And probably the one thing that's going to disrupt a lot of the things that we do today is genome editing. And technologies such as CRISPR have actually made this whole editing much more simpler, much more cost effective, and therefore very, very disruptive. And we've started seeing examples of that, both in terms of diagnostics, but also in terms of therapeutics and in terms of understanding on looking at it in terms of what's going on in agriculture, what can happen in the field of drug discovery and many more such areas. We'll also see that AI will be much better developed, and as a result, the predictions and the kind of responses that you will get will be far better. We are moving towards the whole personalized medicine, which basically means that it's going to be a lot more predictive, personalized, and it's going to look at participation from consumers, and it's also going to be a lot more personalized as we go along in terms of how it's going to affect you as an individual. We also hope that we'll be able to see the same-day cancer treatment and for treatment for diseases such as Alzheimer's and better vaccines. And when you look at all of that, I think the future is now. And I'd like to talk a little bit about what we are doing currently in this space. And that's one of our products called Genome Patri, where we are looking at making it accessible by making sure that consumers can do it in the privacy of their homes, where they can take their own sample with a little swab and send it back to us. And they get back a 200-page report that sort of gives them a detailed understanding of their holistic health. And this is sort of an example of what you would get in the traits, and that would include very interesting things like alcoholism, your caffeine consumption, and blood pressure, and BMI, and obesity. You can look at different kinds of cholesterol, peanut allergies, vitamins, and also behavioral aspects like resilience and avoidance of errors and so on. What you can also find out is that you can look at the disease risk, right? So you can understand if in the future, based on your genetic profile, whether you're likely to get a certain kind of, you're likely to have a predisposition to certain kind of diseases, and therefore be able to take certain action to be able to actually change how the disease progresses by using certain interventions. So for example, if I have a high risk of diabetes, the way we would intervene is through diet, exercise, but also through using things like your sensors, monitors, and the way of analyzing data and being able to use other methods like Ayurveda and other things that will help you to be able to manage that process so that you don't actually get diabetes. So what do you get after testing? You basically get genetic counseling, you get a correlation between clinical and family history, you get a very, very personalized plan and diet changes. You can also do biohacking like I do and then come up with an optimal living. So this is just an example that 80% of cardiovascular deaths are preventable and 60% of diabetes deaths are preventable. So there is a lot of scope in making sure that you can use the genome mapping to be able to help you in reducing the risk of certain kinds of diseases, but also in understanding what kind of foods work for you, what kind of, what sort of exercise works for you and so on. What your genome can also tell you is where you came from. So you can understand if your ancestors had a little bit of Uttar Pradesh or Northeast India or Rajasthan or Europe or Russia and so on. And I think that's where you can find what is going on with your DNA. So our team is now actually more than 250 people. We do both COVID testing, molecular diagnostics, blood testing, as well as personal genomics. And what I gave you was an example of what we do, but we also do it for very high-end genomic screening and being able to help physicians in understanding the root cause of disease, and to be able to also understand how we can look at your drugs and how we can profile them. So thank you very much.
It's been more than a year since.
Thank you. Thank you, Anu, for that. And with that, we come to the end of a stimulating Flash Talk session. I hope it inspires all of us to do more with technology, especially all the stakeholders in healthcare, so that healthcare can become more accessible and affordable for all. Thank you to all our wonderful speakers today and the live audience for joining us today. That's all from my end. Over to you, Syed.
Hi, Jisha. Thank you so much. This was really quite a thought-provoking, presentations, and a lot of things to learn and a lot of things to take back from these two sessions actually today. I think it has been our honor of hosting this summit series, essentially looking at the future of healthcare. And we are going to continue this conversation. Our next summit is going to be in Uttar Pradesh on 22nd of October, which is just a month away. And I think the key thing for us, the key takeaway from us is that we are, there are a lot of problems out there, there are a lot of challenges out there, but with a good conversation, with a thought-provoking conversation, we can reach to some consensus, some collaboration, some partnerships, which can eventually help us to do better in terms of public health delivery, or awareness about public health. Awareness takes me to our another initiative, which Jisha, actually you lead on First Check. So, and I was glad Dr. Rao mentioned that during his final remarks, that we are running this very unique and beautiful collaboration between doctors, technologists, and journalists in the last 4 or 5 years, which has been globally recognized. I will do encourage all of you to do join us on firstcheck.com, which is a fact-checking platform. Another major initiative which we have taken and we're building that up is making data. There was a lot of discussion today about data, making health data accessible for everyone. We have launched a global initiative, a global data repository on public health called crux.com. My colleague Shwali may share the links here. So these are two important platforms which we really want to engage with a lot of partners, stakeholders, and we're always open for conversations. So you have email ID of Shivali there or Jisha. Please do chip in, drop a mail anytime. If you have any questions still about today's presentations, you have suggestions how we can improve the future conversations, or you have questions for the individual speakers today, we'll be very happy to take your questions to the speakers and come back to you, with that. So thank you so much for joining today, and Surbi, for your final thoughts.
Thank you so much. I think our first session, the plenary session, and followed by the flash talk, both were really, really good and quite evident from the questions that we have received and the feedback that we've been receiving. This actually, the session has gone live on YouTube, and so the feedback that we're receiving for this one, as well as thank you all our participants in here, and we look forward to another great session, which is in Uttar Pradesh on 22nd of October. So if you have anything, any kind of questions that you have for today, like Syed said, please put it back to us, and we will ensure that we get back to you. We could not take all the questions because, of course, we are a little short on time and we wanted to wrap it on time. We're still running late by a few minutes, but doesn't matter. I think that's some of the nuances of going online. So a big thanks once again, and thank you so much. Before I wrap up, thank you so much to all our partners, SAP and NTT Data Business Solutions, for making this possible, this important discussion possible. Thank you. Thank you, Jisha.
Thanks a lot. Thank you so much, everyone. Take care. Thanks a lot.
Right. Bye-bye.